Hello everybody, in this video we are going to talk about the bacteria Staphylococcus saprophyticus. If we break this word down, we have Staphylococcus, which refers to a bunch of cocci bacteria, and saprophyticus, which refers to a bacteria that grows on dead and decaying matter. If we put the words together, we have a cluster of cocci bacteria that grows on dead and decaying matter. The features of this bacteria are that it's gram positive, it's catalase positive, coagulase negative, urease positive, Novobiocin resistant. It's a facultative anaerobe which is non-sporing and non-motile. How does Staphylococcus saprophyticus enter the human body? When the human eats a meat that's contaminated with this bacteria, it will enter the human body. Now, just by eating the meat and it entering the human body, is it going to cause any issue to me? No, that's not how it's going to cause an issue. When the human will defecate, feces may have some of the bacteria, and this bacteria may remain on the perineum. Slowly, this bacteria will start colonizing the perineum and become the normal flora of the perineum. Now, other openings that are present on the perineum are vagina in females as well as urethra in both males and females. If this bacteria enters the vagina, it's going to cause no issue. In case it enters the urethra, it's going to give us urinary tract infections. Now, what exactly does it do to give us this urinary tract infection? So, if you remember, while discussing the features of this bacteria, we stated that it's urease positive, which means it makes the enzyme urease, which is capable of converting urea into ammonia. And this ammonia is basic. So the normal pH of this urinary tract is going to be acidic. It's going to be a low pH, which means it's acidic in nature. But when this bacteria enters the urethra, it's going to start converting all the urea that's produced by the human and turn it into ammonia, which makes this basic. And hence, it's easier for the bacteria to survive in a basic environment. Now, what is the problem that may be caused if it converts urea into ammonia other than the environment being favorable for the bacteria? Another issue that's possible is that ammonia can combine with phosphate and magnesium in order to form ammonium magnesium phosphate. This is also known as struvite calculi or struvite stones that can form in the urinary tract, which may be an impediment for the urine to pass, as it may act as a blocker. It's important to keep in mind that urinary tract infections are more common in females than they are in males. You may ask, why is it more common in females? That's because females have a very short urethra while males have a longer urethra. Hence, when the bacteria becomes the common flora of the perineum, it has to travel a very short distance in order to enter the urethra of the females, whereas it has to travel a larger distance in case it wants to enter the urethra of the males. Hence, females are more susceptible to urinary tract infections as compared to males. Another characteristic feature of this bacteria is its ability to form biofilms. Biofilms act as this protective shield which prevent any kind of immune cells or antibiotics to enter it and gain access to the bacteria. Hence, treating infections or any kind of conditions caused by this bacteria becomes difficult. These bacteria also colonize urinary catheters, and hence, in case of any implants being put here, they have to be removed. In order to treat this condition, we can give the patient two kinds of drugs. Either we can give them nitrofurantoin or we can give them a combination of sulfamethoxazole along with trimethoprim. Since this bacteria is associated with renal calculi, which acts as a blockage of urination, hence if we give nitrofurantoin, we will obtain a night full of urination. Hence, we can remember nitrofurantoin associated with night of urination. In order to memorize sulfamethoxazole and trimethoprim, we can consider that the individual, due to his urinary tract infection, has not been able to attend school or work and hence has lost all of his fame. His fame has come to zero. Hence, the drug themselves are advising to try the drug or try me in order to prime their fame. Hence, sulfamethoxazole so fame to 0, and trimethoprim is try me to prime. I hope this video was helpful in understanding this bacteria and its associated concepts. That's all we have for today. Thank you.